Okay, let's step into one of the highest stakes learning environments you can possibly imagine, medical school. For decades, training future doctors has followed a pretty familiar path. But now, a technology that feels like it's straight out of science fiction is literally changing the entire game. I mean, really think about that question. How do you practice something as delicate as heart surgery for the very first time? If the first time you're performing a complex, life-saving procedure is on a living, breathing person, how do you possibly get it right? How do you prepare for that kind of pressure? For generations, the answer has been, well, a mix of theory and some very closely supervised practice. But that traditional path, it's filled with some huge challenges, forcing students to learn under the most intense pressure imaginable. Let's just break this down. On the one hand, you've got the traditional way. You study theory for years, right? And then your hands-on practice is totally unpredictable. It just depends on whatever cases happen to walk through the hospital doors. And the cost of a mistake, it's terrifyingly high. But the VR approach, it just flips that whole script. You can practice anytime in a totally safe, repeatable simulation where the risk to patients is absolutely zero. This analogy just nails it, doesn't it? It perfectly captures that huge leap of faith that's been required in traditional training. You can read every book in the world, but nothing fully prepares you for the real thing. It's just a high-stress, high-risk way to learn a skill where precision is everything. So, if that's the problem, what's the solution? Well, this is where we get to step into the virtual operating room, where technology is giving us an answer that was frankly unthinkable not too long ago. At its core, VR training is exactly what it sounds like, a powerful, simulated world. Trainees just put on a headset and boom, they're instantly transported into a hyper-realistic medical scenario. They can see, they can interact, and they can perform these incredibly complex tasks as if they were actually there. And this is the crucial part. VR completely removes the biggest barriers to practice. A medical student can now run through a tricky procedure dozens of times, at 3 in the morning from their own apartment, all before ever touching a real patient. It's all about building that muscle memory and confidence in a completely safe space. Okay, this all sounds fantastic in theory, but is it actually rewriting the playbook for how we educate doctors? Let's take a look at the data, because that's where you see the real impact this tech is having. And that is the critical question, isn't it? It's one thing to have a really cool piece of technology, but does it actually produce better doctors? Well, the research is starting to give us a very, very clear answer. And the answer is a definitive yes. A landmark study from 2021 found that students trained with VR were a staggering 29% faster when they performed surgical procedures compared to their traditionally trained classmates. In a real operating room, that kind of efficiency can make a world of difference. And if being faster is impressive, this is where it becomes a true game changer. Those same VR-trained students made 6 times fewer errors. Let me say that again, not 6%, 6 times fewer. That is a monumental leap forward for patient safety. So why is it so effective? The reason is actually pretty simple, and this analogy explains it perfectly. The more you rehearse something in a low-stakes environment, the more automatic and confident your performance becomes when the pressure is really on. VR is basically a rehearsal space for surgery. But here's what's really important to understand. This technology goes way beyond just technical skill, beyond the virtual scalpel. Some of its most profound applications might actually be in developing one of the most important skills any doctor can have: empathy. Imagine this. You're a young doctor. You put on a headset, and suddenly you're experiencing the world through the eyes of a patient with Alzheimer's. You're feeling the confusion, the memory gaps. This isn't just learning from a textbook. This is building a deep, first-hand understanding of a patient's reality. It fosters a connection that can literally change how you practice medicine. Now, as promising as all of this is, VR is not a magic wand. We have to be realistic and look at the real-world challenges and, understand where this technology is heading next. The reality is there are still hurdles. The hardware can be costly, though prices are coming down. Creating effective, medically accurate simulations takes a ton of expertise. And, of course, no simulation can ever perfectly replicate the pure chaos and unpredictability of a real-life emergency. The next big thing is integrating better haptic feedback, so the sense of touch, and using AI to create scenarios that adapt in real time. And this is probably the most important takeaway of all. The goal of VR isn't to replace traditional medical education. You'll never replace hands-on mentorship or real-world experience. It's to make it better, to enhance it, to give students a powerful tool to practice and prepare like they never could before. Because in the end, it doesn't really matter whether a doctor learns from a dusty old textbook or a futuristic headset. This is what it all comes down to. The technology changes, but the fundamental human mission of medicine, to heal and to help, that stays exactly the same. So I'll just leave you with this thought. We've seen how VR is revolutionizing medicine, but flight simulators have been doing this for pilots for decades, and they've made our skies incredibly safe. The real question now is, where else could a virtual rehearsal save lives?